Hello and welcome to the first in a series of videos devoted to dispelling the myths and misconceptions that surround many aspects of cosmetic dermatology and non-surgical aesthetic medicine. Today's subjects will include dispelling the myths and misconceptions regarding treatment with gizmos like Fraxel Lasers, radio frequency devices, ultrasound technology devices, intense pulse light and broadband light devices, as well as even dynamic muscle stimulation devices, the latest supposedly hot thing to come along. My name is Dr.Novick. I'm a cosmetic dermatologist with a practice devoted to non-surgical aesthetic dermatology and treatments located on the Upper East Side of Manhattan. I am an emeritus clinical professor of dermatology and attending physician at the Mount Sinai Medical Center in New York City. I am an emeritus fellow of the American Academy of Cosmetic Surgery, the American Society for Dermatologic Surgery, and the American Academy of Dermatology. I've authored numerous papers on medical subjects and have written many books on skincare for the general public. These include Saving Face, a leading dermatologist's guide to the latest breakthroughs in skincare, Super Skin, Skincare for Teens, and You Can Look Younger at Any Age. When it comes to energy-based devices and light-based devices, don't be fooled by the claims cleared by the FDA or FDA cleared. That simply means that the machine was used on a few subjects in one or two doctors' offices, and they basically showed the FDA that it was the machine or the particular device, the particular gizmo, was safe for use in the human subjects that they tried it on. It doesn't mean that it actually is effective for the purposes they claim that it's supposed to be effective for. I have no problems with lasers in certain areas of medicine. In ophthalmology, for example, they have made tremendous strides. Unfortunately, it has not been particularly successful in the cosmetic aesthetic medicine field. I have so many patients that come to me so often in their first consultations complaining about how much money they've lost and how much time they lost and their frustration and their aggravation with these light and energy-based treatments that they went through basically for nothing, for their acne scars or for their wrinkles or for skin tightening or for whatever. So it's very, very important to keep in mind that the claims of FDA clearance don't mean that the machine or device is going to be God's gift to humanity. So what's the doctor's role after the machine has gotten its FDA clearance? Well, basically the company that sold the machine, and these machines can run anywhere from about $85,000 to $325,000 for the machine. The question comes, how do you market this? How do you market the machine so that the doctor can get the return on investment? So with the advice of the company, usually they say, well, offer free consultations. Now, you can offer 8 to 12 consultations free per hour, but you realize that comes out to about 5 minutes per consultation, and you basically get what you pay for it. Nothing begets nothing. So how does it work? The patient opens the door of the room of the free consultation, and before the patient even has a chance to plunk themselves down into the seat opposite the physician, the physician says, oh, you need the machine, which is the machine that he or she has just purchased. Now go out and see my cosmetics coordinator, and he or she will sign you up for the 4-treatment package, which it can run about $1,000 a pop, so $4,000 for the package, and then you're all set with the package. So what are the roles of the skin influencers that you see on Doctor's YouTube, Dr. Google, Dr. Snapchat, Dr. TikTok? I mean, these skin influencers very often have skin in the game, and that's a pun intended, where they're being paid basically to sort of advertise whatever device they are supposed to be advertising. So the advice of these skin influencers usually runs like this: okay, I'm going for my treatment, and I'll let you know in 2 weeks. And in 2 weeks they come back, I think I'm a little bit better. I'll let you know in another 2 weeks. And by that time, many people get hooked into it, and they end up in the doctor's office, and they go through the routine that I already explained, and they end up going through the 4 treatments. So if these machines are not really terribly effective or effective at all, how do they get away with it? That's what question that my wife asked me many years ago. And the answer lies in the concept of buyer's remorse. Imagine this. You've now plunked down $4,000. You've spent 4 months coming in once a month for 4 months. And you have to now look in the mirror. So what you see looking back in your mirror, you have to say, I think I'm a little bit better. Because if you don't say, I think I'm a little bit better, then you have to face the reality that you have just down the drain $4,000 of hard-earned money, the time, the frustration, and the aggravation. So what are some final suggestions to avoid all the drama, the pain, the aggravation, the needless expense, and the disappointment? Well, the first thing to exercise is buyer beware. Be skeptical. If a device's treatment sounds too good to be true, it most likely is too good to be true. So it's very, very important to keep in mind that whatever is hyped as new and improved may very well be new, but most likely has yet to be proven. So when you go in for a consultation, make sure it's not one of these freebie 5-minute consultations, because in 5 minutes or 10 minutes, a doctor really does not have the time to be able to really evaluate and then evaluate any of the particular problems that you have, or to develop a treatment plan that's specific for your needs. In my own office, in fact, my first consultations are 1.5 hours long, one-to-one with me. Follow-ups are an hour, but the initial consultation is 1.5 hours long, one-to-one, which gives me sufficient time to be able to understand the problems, evaluate the specific problems, make a very, very specific treatment plan for that person, answer any questions, specify prices for treatments, and to discuss what to expect before and afterwards. That's what a real consultation should consist of. The other thing is that if you do opt for any one of these treatment gizmo machines, find out who is going to be giving the treatment. Most often, and I hear this from patients all the time, it's some employee in the office who has gotten a short training period from the sales rep that sold the office the particular gizmo, and that's who is going to be giving the treatment. You really want to have the doctor giving the treatment. So this is a very, very important thing to keep in mind if you decide that you want to go with one of these treatments and risk treatment with one of these gizmos. Future videos will cover such subjects as treating the agony of acne scarring, the latest breakthroughs in treating acne breakouts, taking the flush out of rosacea. And for more information, you can check out my website, youngerlookingwithoutsurgery.com. That's youngerlookingwithoutsurgery with no periods.com, or Dr.Novick.com. That's DOCTORNOVICK.com. Thank you for your attention. I look forward to our next talk together.